Your pet isn't slowing down because they're getting older. They're slowing down because they're in pain. And there's a difference. We see it every single autumn. The stiff dog who takes a few steps to warm up in the morning, the cat who stopped jumping up on the bed, the pet who's a little quieter and a little less themselves, and the owner who tells me, I just thought it was their age. Age isn't the problem. Unmanaged pain is. By the end of this, you'll know what to actually look for, why autumn is a season that unmasks pain that's been hiding all year, and what's available to help your pet move more comfortably without it being complicated. April in Sydney is gorgeous. The humidity drops, the mornings get crisp, and we all feel a little more human again. But if your pet has any arthritis, and statistically, if they're over 7, there's a very good chance they do, autumn is the season when that quiet, manageable background discomfort can shift into something more noticeable. Here's why that matters. Arthritis is the most underdiagnosed and undertreated condition I see in general practice. Not because it's rare, it's incredibly common, but because animals are extraordinarily good at hiding pain. They didn't evolve to show weakness, so they compensate. They adjust. They quietly stop doing the things that hurt. And we, as the people who love them, often read that as slowing down with age, rather than my pet needs help. The good news is, once you know what you're looking for, it becomes a lot harder to miss. And once we find it, there's genuinely a lot we can do. And that's what I want to talk to you about today. Why does autumn make pain worse? Well, cold weather and changes in the barometric pressure, that's the atmospheric pressure around us, are well-recognized triggers for joint pain flare-ups. We see this in humans too. That friend who says, I can feel the rain coming in their knees, that's a real thing. For a pet that's had low-grade arthritis ticking along in the background, the cooler temperatures of autumn can tip that discomfort into something more obvious. Muscles will tighten, joints that were coping in the warmth of summer suddenly need more help. Add to that the fact that many pets are a little less active over summer, shorter walks in the heat, more resting indoors in the aircon, and their muscle condition, which is one of the key supports for arthritic joints, has often declined a bit heading into autumn. It's a combination of factors, and it means that right now, in April, is one of the most important times of year to pay attention to how your pet is moving. Elmo is moving away. What pain actually looks like in pets and why we miss it. Now, this is a big one because pain in pets rarely looks like pain in humans. We expect limping, we expect crying, we expect some obvious signal. But most arthritic pets, especially cats, and especially stoic breeds like Labradors and Golden Retrievers, show pain through subtle behaviour changes. And here's what I actually see in the consult room. A dog who used to launch off the back of the couch onto the floor, now they carefully climb down. A cat who hasn't slept on the top shelf of the cat tree in months. A dog who hesitates at the top of the stairs or asks to come inside earlier on a walk than they used to. A pet who's a bit slower to greet you at the door. A cat who stopped grooming at the base of their tail because it hurts to twist around that far. None of these look like a pet in pain, but they are. The clinical term is pain behaviour substitution. Animals stop doing things that hurt rather than crying about them. And because the changes often happen gradually, we don't notice until the difference is quite significant. If you think back 6 months to what your pet was doing freely and compare it to now, that's often where you find the gap. The 7-day pain trial and why it can be so revealing. One of the most common conversations I have in autumn goes something like this. A client comes in, their pet is older, they say, I'm not sure if they're in pain or if this is just what getting older looks like. And I say, well, let's find out. A pain trial is exactly what it sounds like. Under veterinary guidance, we give a pet appropriate pain relief for a short period, usually around 2 weeks, and watch what happens. And what happens is often remarkable. Dogs who are moving stiffly start trotting on their lead again. Cats who had gone quiet start playing. Pets who seemed a little flat just start being themselves again. I've had clients come back in after a pain trial with tears in their eyes saying, I didn't realize how much they were holding back or how uncomfortable they were. And that is generally one of the most meaningful moments in practice for me. A pain trial doesn't give us a definitive diagnosis on its own. That often involves an examination and sometimes imaging, but it's a powerful piece of information. If a pet responds well to pain relief, that tells us something important, and it guides the conversation about what ongoing management might look like. It's not something to do at home without veterinary oversight. The medications we use need to be prescribed and appropriate for each individual patient, taking into account their age, their breed, and any other health concerns. But it's a relatively simple, low-risk way to answer a really important question. Is my pet in pain? Laser therapy. What is it and why we use it? I want to talk about laser therapy because I think it's one of the most underutilized tools we have for managing pain and mobility in pets. And it's also one of the most misunderstood. It sounds more complicated than it is. Laser therapy, specifically low-level laser therapy or photobiomodulation therapy, uses light energy to reduce inflammation, support tissue healing, and provide pain relief. There are no needles, no sedation, and no restraint. Most pets actually seem to find it quite pleasant. There's a warmth associated with the beam, and many of them just settle and relax during their treatment. We prescribe laser therapy for arthritic dogs and cats, for post-surgical recovery, for soft tissue injuries, and for pets who can't tolerate certain medications. It's performed by our nurses, which means it's accessible and can be done regularly over time. It doesn't replace a full management plan, but we think about pain from multiple angles. But for a lot of patients, it makes a really meaningful difference to how they move and how they feel. What I love about it is that it's gentle, it's fear-free compatible, and it's for pets who are anxious about coming to the clinic. The way we deliver it, quietly, at the pet's pace, with treats involved, Elmo, you love it? Tends to be genuinely positive for them. The multimodal approach, why pain management isn't just one thing. In veterinary medicine, we talk about multimodal pain management. That sounds very clinical. What it actually means is pain is complex and one tool is rarely enough. For most arthritic pets, the best outcomes come from combining approaches. Appropriate pain relief medication, weight management where needed, because every extra kilo we can reduce from an arthritic joint makes a real difference. Controlled, consistent exercise. Not too much, not too little. Laser therapy. Sometimes acupuncture, which I've used in practice for years and find genuinely valuable for certain patients. And for dogs with more significant mobility impairments, canine rehabilitation therapy, targeted physiotherapy for animals. No two patients get the same plan. A 9-year-old Labrador with moderate hip arthritis is a very different patient to a 14-year-old cat with spinal changes. The conversations we have in the consult room is about understanding your individual pet, their health history, their lifestyle, what they love doing, what's changed, and building something that works for them. The goal is always quality of life, not just more years, but better years. I've been in veterinary practice for over 28 years, and the thing I wish I could go back and tell pet owners, including some of my own clients over the years, is this: don't wait for them to limp. The absence of limping does not mean the absence of pain. I say this gently because I understand why we wait. We don't want to project. We don't want to medicalize normal aging. We love our pets and we don't want to think about them suffering. So we look for the obvious signs and we tell ourselves they're fine, they're just slowing down. But the pet who is quietly avoiding the stairs, who no longer greets you at the gate, who used to sleep stretched out and now curls tight, that pet is telling you something, and we need to know how to listen. What I've observed over decades of practice is that when we get on top of pain early, when we identify it before it has been going on for months or years, the response is so much better. The pet has less compensatory muscle loss. They haven't developed secondary problems from moving awkwardly to protect themselves. They haven't lost condition. Early feels like nothing's wrong, but early is actually when you have the most options. From a fear-free perspective, I also want to say that pain can make clinic visits worse. A pet who is already uncomfortable is a pet who's harder to examine, harder to treat, and harder to keep calm. So managing pain well at home is part of keeping the clinic experience a positive one. It all connects. And one more thing, I know this is long-term care. I know it's an ongoing conversation rather than a fix-it-once visit. But that's exactly the kind of medicine I believe in. The kind when we're genuinely looking after your pet across their whole life, not just patching things up when it gets bad. And that's why we're having this conversation in April, because now is the right time to be paying attention. Here are 5 things you can do at home today, this week, to tune in to how your pet is really moving. Number 1, watch them first thing in the morning. This is when stiffness is often the most visible. How long does it take them to warm up? Do they move easily from lying down to standing? Do they shake it off quickly, or do they take several minutes to find their stride? Number 2, notice what they've stopped doing. Not what they're doing now, what they used to do, that they've just quietly stopped. Jumping, climbing, playing, greeting you at the door. Changes that happen gradually are easy to miss, but they also matter. Number 3, watch them on the stairs or getting in and out of the car. Hesitation, slowing down, looking for a way around. These are kinds of compensations that often show up before any obvious lameness does. Number 4, check their body condition. If they're carrying extra weight, that puts real pressure on their joints. If you can't easily feel your pet's ribs, it's worth a conversation with your vet about whether their weight might be contributing to any discomfort. And number 5, trust your gut. You know your pet better than anyone. If something feels different, if they seem quieter, less interested, a little flat, that's worth paying attention to. You're not overreacting, you're noticing. If anything I've talked about today feels relevant to your pet, if you're watching them thinking, actually maybe, there's a few ways that we can help. Our nurses offer free dental checks, but they also have a really good eye for mobility changes during a visit. So if you're bringing your pet in and you want a second pair of eyes on how they're moving, just ask. We also offer rehabilitation therapy, consults for dogs, acupuncture for appropriate patients, and laser therapy, all of which can be part of a pain management plan. If you'd like to have a proper conversation about whether your pet might benefit from a pain assessment or what a pain trial looks like, our vets are genuinely happy to talk you through, and that's what our consultations are for. And if getting to the clinic is difficult or your pet really struggles with car travel, telehealth is always an option for an initial conversation. No pressure, just options. We're here when you're ready. Tonight, just tonight, I want you to watch your pet get up from wherever they're resting. Watch how they do it. Do they spring up or do they take a moment? Do they shake themselves out or do they move really slowly? You don't have to do anything with what you notice. Just notice. Because the pet owners who catch pain early aren't the ones with some special knowledge. They're just the ones who are paying attention. And you're already doing that. You're here.